Alright, so our PowerPoint is about skin cancer. Skin cancer is defined as the abnormal growth of skin cells throughout the body. There are 3 types of skin cancer that can form in the body: basal cell carcinoma, squamous cell carcinoma, and melanoma. The leading cause of skin cancer is long-lasting sun exposure or frequent use of a tanning bed. Skin cancer can form on any area of the body, but it is more prevalent in areas with high sun exposure rates. There is an infection called actinic keratosis, which is a precancerous condition that can develop into squamous cell carcinoma. 1 in 5 Americans develop skin cancer throughout their lifetime, which is why self-examination is very important to catch the cancer early. Older individuals will have a higher risk of skin cancer compared to younger children because they have been exposed to more sunlight.
Pathophysiology is the physiological process of a disease or an injury. The pathophysiology of basal cell carcinoma is that as new cells are created in the basal layer, they could be damaged, which causes basal cell carcinoma. It's often due to ultraviolet radiation to the epidermis. Some physical findings of basal cell carcinoma is that the skin may appear red or pink. There may be some shiny bumps or open sores, and those bumps and sores may open, bleed, or itch. Some scars may be seen. The history of basal cell carcinoma is often seen in people with a history of skin cancer, people that have chronic exposure to sunlight, and a person with a history of sore skin. The pathophysiology of squamous cell carcinoma is that it affects the epidermis of the skin due to some DNA damage from exposure to ultraviolet radiation. If it's left untreated, it can spread to other parts of the body. Some physical findings that it's normally red nodules that are firm. It could appear flat and scaly, or come from a sore, from an old scar or an ulcer. It's mostly seen in patients with a history of skin cancer, precancerous skin lesions, patients that have a weak immune system, or even a genetic disorder. Pathophysiology of melanoma is DNA damage to melanocytes. The exact cause is unknown, but it's suspected ultraviolet radiation because when it's exposed, it causes an increase in the production of melanin. There are 4 types. There's superficial spreading melanoma, lentigo maligna, acrolentigenous melanoma, and nodular melanoma. Just some general rules. The ABCDE rule for asymmetrical, border, color, diameter, and evolving. You're at increased risk to get melanoma if you live close to the equator and high elevation, or you have a family history. Superficial spreading melanoma, some physical findings, is that it's normally found on the legs, torso, and upper back. Could be slightly raised or flat and discolored. It's also asymmetrical. Lentigo melanoma is often seen as flat or raised. It's often a spotted patch with uneven borders. It's mostly seen on the hands, arm, and the face. Acrolentigenous melanoma is hard to spot because it's mostly found on the soles of feet, on the hands, or under the nails. Nodular melanoma is found on the torso, legs, arms, and the scalp of often older men. It's a bump on the skin and it's usually black.
When talking about skin cancer, or any disease at all really, it's important to talk about the incidence and prevalence of it. So the incidence is how fast the disease is spreading. So it's the amount of people that develop skin cancer within a certain period of time. And prevalence is the number of people within a certain population who have the disease in a certain period of time. So between the years of 1994 and 2014, non-melanoma skin cancer increased by 77%. For basal cell, there were 3.6 million new cases in the U.S. alone within the past year. Squamous cell, there were 1.8 million new cases in the U.S. within the past year. And then for melanoma, there were a total of just over 99,000 new cases in the U.S., and for men that would be around 57,000, and women there were 43,000 new cases. And then Merkel cell, which is a very rare and extremely aggressive type of skin cancer, it increased 95% between the years of 2000 and 2013. And then the graph on the right shows that there were, of the non-melanoma skin cancer, 67% of it is basal cell and 33% of it is squamous cell, showing that the basal cell is more prevalent than the squamous cell.
When looking at treatment for skin cancer, it may seem like the options are endless. The first option that we're going to discuss is topical chemotherapy. This is typically in the form of a cream or an ointment and is applied to a specific region where the cancer is located. One type of topical chemotherapy is 5-fluorouracil or 5-FU. This is used to kill tumor cells located on or near the surface of the skin, and side effects include skin sensitivity and typically redness. The next form of treatment is intravenous chemotherapy. This is the typical chemotherapy that we would think of for other sorts of cancer, where it goes into the vein through an IV. While it is most effective for a lot of things, it is also most damaging to the body. Our next form of treatment is immune response modifiers. These are specific drugs used to attack cancer cells within the body and improve the body's immune response at the same time. One type is imiquimod, also known as Xyclara. This is used to treat early basal cells by being applied directly to the skin multiple times a week through cream for several weeks. It destroys skin lesions by initiating the immune response at the site. Continuing on with squamous cell and basal cell carcinoma treatment, we have photodynamic therapy. This uses specific drugs, sometimes called photosynthesizing agents. These agents are placed on the location of the skin cancer and then activated by light. The activation causes the medication to attack and kill the cancer within that region. Cryotherapy is when a liquid nitrogen is applied to the tumor in order to kill cells by freezing them. This is also known to be used on warts on the skin. We have laser surgery. This can be used to treat basal cell carcinoma on the surface of the skin, and squamous cell carcinoma in situ. Next, we have Mohs surgery. This is the most effective type of cancer treatment for squamous cell and basal cell carcinoma. This happens when there's a visibly raised area. A surgeon will slowly remove layer by layer of the skin. Every layer that's removed is immediately examined under a microscope. Additional layers of tissue continue to be removed until it's determined that there's no longer any cancer cells within that region. When looking at treatment for melanoma, it's quite different. Removal of melanoma is what's done in early stages. This is just the actual removal of the cancer, kind of like squamous and basal cell carcinomas as well. Melanoma can spread to the lymph nodes, and at this point you would need a lymphadenectomy, which is where the lymph nodes of the body would actually be removed. If melanoma metastasizes, this is where you'd need a mastectomy. This is when the melanoma metastases are removed from the organs it has been spread to. When looking at success of treatment, it depends on the person, the form of treatment that you're using, and also the form of cancer that you're treating. Cure rates are typically pretty high when you're using an excision of the actual cancer. With basal cell carcinoma, as long as you have 20 millimeters or less, there's a cure rate of 95 out of 100 individuals when performed within a 4 millimeter margin. With squamous cell carcinoma, 92 out of 100 people have cure rates due to the same excision. When looking into chemotherapy use on skin cancer, it's important to look at the topical forms used. As discussed before, 5-FU. This form of chemotherapy is now FDA approved and can be used in cases of basal cell carcinoma with a cure rate between 80% and 90%. Mohs surgery is still the leading form of treatment with skin cancer. Most Mohs surgery uses such specific margins that it's up to 99% accurate in curing the entire cancer lesion on the body. When looking at treatment success rates for melanoma, it's quite different seeing that melanoma is such a severe form of skin cancer. When patients have melanoma, they typically are using more than one form of treatment. With more than just one form of treatment, there's typically only still a 63% survival rate.
When going through any part of the nursing process, it is vital to understand the patient's cultural background. As an overview, culture is a social construct where a certain group of people will have similar ideas. It is important to note, though, that none of these quote-unquote rules are written, and not everyone within the culture decides to follow every single rule. It is important to see how your patient is involved in the culture and what ideas they have. Culture can affect how the patient may view their current health status, how a healthcare provider will display information based on the patient's views, how the patient's symptoms are understood, and the patient's reaction to their current health status. It is vital to adapt to their reactions and to comfort them in any way possible. There are many barriers that you have to overcome when dealing with culture. This includes language barriers, the patient's education, like how they may view their cancer, how it is affecting their family and the community that the patient lives in. The patient may have previous thoughts about the healthcare system due to their culture's past experience with hospitals and treatment options. There are also cultural beliefs, including weight. In some cultures, weight is not seen as an issue and is sometimes encouraged, so they are less likely to be able to see small abnormalities of the skin as they're not hyperfixated on looking in the mirror to see any weight loss or weight gain changes.
A prognosis is the likely outcome and course of a patient's disease. Some factors that may impact a skin cancer patient's prognosis are the type and stage of cancer, the location of the cancer, the patient's overall health, their age, and how they respond to treatment. A skin cancer prognosis is based off of a 5-year survival rate, which is the percentage of individuals living with their cancer diagnosis after 5 years. These rates change depending on different types and stages of various cancers. Basal cell and squamous cell carcinoma are the most common forms of skin cancer and are diagnosed about 5.4 million times a year. But due to increased sun exposure but better detection methods and people generally living longer, the death rate is decreasing, but the diagnosis rate continues to increase. For basal cell carcinoma specifically, treatments can often result in an 85 to 95% chance of becoming and staying cancer-free, especially when the cancer is found early. Regional cases have spread to nearby structures or the lymph nodes, and distant cases have spread to other parts of the body like the liver or lungs. Each category has a different 5-year survival rate percentage. Localized has a 99% survival rate, regional has a 68% survival rate, and distant has a 30% survival rate. While these percentages are accurate, these are based solely on the stage of cancer when first diagnosed, and doesn't take into account the factors that may affect a patient's prognosis. In general, the best ways to stay protected from skin cancer while living with cancer or after being cured are by wearing a sunscreen with an SPF of at least 15 every day, never using tanning beds, not getting sunburnt, avoiding tanning when possible, reapplying sunscreen every 2 hours, especially if you are playing sports or swimming, seeing a dermatologist once a year for a full skin check, and keeping watch of old and new moles and freckles, their size, shape, color, and how they are evolving each month.
Question 1. A woman finds out her cancer has spread to her lymph nodes. What type of melanoma does she have? A. Localized, B. Regional, C. Distant, D. Stage 1. B. Regional. Question 2. Which type of melanoma is typically found on the hands, arms, and face? A. Superficial spreading melanoma, B. Acral lentiginous melanoma, C. Nodular melanoma, or D. Lentigo maligna. The answer is D. Lentigo maligna. Question 3. What is the most effective treatment for skin cancer? A. Intravenous chemotherapy, B. Mohs surgery, C. 5-fluorouracil, D. Radiation. The answer is B. Mohs surgery. Question 4. What is the most prevalent type of skin cancer? A. Merkel cell carcinoma, B. Squamous cell carcinoma, C. Basal cell carcinoma, or D. Melanoma. The answer is C. Basal cell carcinoma, 97% of non-melanoma. Question 5. The infection actinic keratosis is precancerous condition that can develop into which type of skin cancer? A. Basal cell carcinoma, B. Merkel cell carcinoma, C. Melanoma, or D. Squamous cell carcinoma. The answer is D. Squamous cell carcinoma.
There are many differences in end-of-life care depending on your culture. For example, families from Eastern countries are less likely to put older family members in a nursing home and instead would rather just take their loved ones home to care for them themselves. Healing practices are a large factor with culture as well. There are many additives that the patient may want to include in their treatment, so it is vital that you check to see if there are going to be any negative reactions with the treatment already being provided through the hospital. If there are, it is imperative that you talk to the patient about this to get their input and to see if there are any other options. It's imperative that you try to include every part of the patient's culture into treatment and to respect them at all times. You should be continuing to educate your patient in ways that they can better their health while still being respectful of their culture.